So if you want top 3 areas, pharmacology, cancer, and micro in every organ system, because, you know, realistically, every organ system has their conditions, and every organ system has cancer and pharm. So you can do that. And also micro is not only its own topic in bacteria, viruses, fungi, parasites, but they also are found in every organ system: heart, lungs, kidney, neuro. So if you want to hit top 3 areas, that's my approach. Others might say pathology, pathophys, and pharm. Good luck. Those are big concepts in every organ system. So I would suggest, Dr. Abraham, like I've said before, when you have my study plan, 2 months or 3 months worth, I would focus heavily on pharmacology, cancers, and make sure that at least when you get questions about CHF or different dilated cardiomyopathies or asthma, COPD, or nephrotic, you're able to answer those. For example, stones in kidney, right? Kidney stones are huge. I would suggest you can go through my online community and say, all right, well, Stavros is creating these AMBOSS sets. You might not have AMBOSS, and I'm sorry for that. I can't do it for UWorld. They won't allow me. But what I usually do is the sets that I provide are the questions that I would study and review, because it's a quick result, like stones, casts in the kidney. Are you familiar with the 5 stones? Do you know the different casts? If I tell you Highland cast, do you get nervous that you think it's something bad? Or you say, well, Highland cast is not bad. H for Highland means it's for healthy people, dehydration, so we're good. Versus we have other casts that are not good to have, like brown cast, brown muddy cast, fatty casts. So I wish I can summarize it further for you, Dr. Abraham, but if you really want to get points, besides immunomicrobiochem, these 3 topics are huge. These 3 topics, immunomicrobiochem, are embedded in every organ system. So if you want to get points fast, focus on those 3 topics first, then do pharm in every organ system, cancer in every organ system, and I will guarantee your scores will jump like that. There's no way it won't. It's impossible, because I know they ask you these questions all the time. All right, Dr. S. Suleiman, do you read or reread first aid after, during, or before practice exams or questions? Okay, well, I'll tell you what I do. First aid is only meant for me to review. First aid is very high yield, and everyone is different. So when I give you advice, it's because this is what I would do, and the majority of doctors that I've worked with, I see the results based upon the advice that we give. So overall, first aid is hard to read because it's very high yield. Some of you have it, don't use it, okay? Some of you use it too much. Some of you keep reading it because you think by reading it's going to stick in here, and then you keep forgetting. So what I would suggest is I would usually use first aid after I do sets of questions. So I'll do, let's say, a set of 40, and I have my first aid open anyway, and I try to attempt to do questions. And if I realize I didn't know the content, going to first aid might be challenging because it's very, very high yield, right? Versus I knew the information, I just forgot. I didn't remember the different factors or different components in that organism, or the virulence factors, like in Pseudomonas, the word PEEP is in first aid. So if I figured I know Pseudomonas well, I just forget their virulence factors, then I would use the word PEEP in first aid to help me remind myself and recall the 4 different virulence factors that Pseudomonas has. So I would use it usually after every question to say, okay, did I know the information? What can I get from it? What was the answer choice say?